Hi there. I'm Dave Browning, the other guy running for Congress from the 6th District of Missouri. That's up in the Northwest Quadrant. And my website is www.daveBrowningforcongress.us. Under federal rules, I'm supposed to tell you that this part of the website is paid for by my campaign committee, which is called, funny enough, Dave's Friends, and the treasurer is Kay Jones. On May the 7th, I was on We the People radio, and a caller named Mo called in and asked what I was going to do about the 45 million people in America that don't have health insurance if I were to be elected to Congress. It's a fair question, and I'll attempt to answer that in this video. First, by way of background, you need to know that I'm one of those 45 million people. Not only am I one of those 45 million people, my situation is worse than many. I have pre-existing conditions which prevent me from obtaining health insurance at a reasonable cost, which I define as being a cost less than my monthly normal medical expenses. I can obtain health insurance, but it is at a rate so high that I consider it to be extortionist, and I elect not to have health insurance. That's not exactly accurate. I could obtain health insurance if I were willing to go to work for some big corporation, and it would have to be a big corporation because of my conditions. I don't do well taking orders from others. I've worked for myself for the last 20 years and will probably work for myself for another 20 years unless I go to work for you. So, there we are. I don't want you to think I'm heartless. I want you to understand that in this situation, I am one of those 45 million people. Now, let us ask ourselves the following question to start this discussion. First, does the Constitution provide in any point where the federal government is supposed to provide you or I with health insurance? And my answer to that question is not that I can find, fella. It's not there. So when Hillary or Obama or McCain or any of these people are saying that the government should provide this health insurance, they are asking us to do things against the limitations on government provided for in the United States Constitution. I don't think that that should be true. I don't see that the United States should be an insurer of your health. I think that is a matter for private insurance industries only. All right. Maybe I'm wrong. Maybe what they're really saying is that you should be compelled to have health insurance. All right. Interesting point. If you are compelled to have health insurance, will that lower the overall cost of medical expenses? I don't see how. If it won't lower the cost of medical expenses, will it make medical care more widely available? Doubtful. If it won't lower the cost or make it more available, in fact, it can't make it more available. In Missouri, health care is a regulated activity controlled by the state. They determine the number of hospital beds, the number of x-ray machines, the number of MRI centers that there are going to be. This is not a thing determined by competition. If doctors were in competition with one another and hospitals were in competition, then of course prices would go down, quality of care would go up. That's how competition works. But in a regulated system, prices never go down, quality doesn't go up, particularly when the government is involved. Now, do we all expect that doctors are going to reduce their incomes to make this healthcare system work? I don't know about you. If you do, That's an interesting way to look at life. Now, would universal health care insurance stop the terrible crisis of bankruptcies that arise from medical expenses? That would be an interesting and potentially real reason to have universal insurance. But, as you all well know, universal insurance, if it follows the present pattern, would probably be an 80-20 affair, just like commercial insurance is today. If it's an 80-20 affair, we'll talk about a friend of mine. He had a 5-way bypass several years back. His 20% was $50,000. Now, he's alive. He's glad to be alive. And he had insurance. But the fact was, he didn't have $50,000 lying around. And that was his 20%. So, he had to take bankruptcy. Fortunately, at the time, he was working for his family, so he didn't lose what few assets he had. But you would, and I would, and health insurance does not prevent that huge tragedy. So what are we doing with this universal health insurance if it doesn't increase the quality of care, doesn't reduce the cost of the care, doesn't expand the care, and doesn't keep us regular citizens out of bankruptcy? Well, if you do the math quickly, just easy figures to follow, 45 million people, $200 a head, a month. Okay, that's about, if I did my math right, $9 billion a month. Now, do we really think that the insurance companies are going to widen the quality of care? Do we think any of the real problems of the system are going to be solved? And the answer to that is no. So what are we doing? Well, what I think we are doing is putting $9 billion a month into the pockets of the healthcare industry. And in this case, the insurance side of the healthcare industry. I don't see that as a valid public purpose. But then I don't see taking your farm from you to build a shopping center as a valid public purpose either. So maybe I'm just not in touch with the times.